So this is a 48-year-old man diagnosed and treated for H. pylori duodenal ulcer. His ulcer was complicated by significant bleeding and hypotension requiring a transfusion. He adhered to a 14-day course of clarithromycin and amoxicillin and has taken omeprazole for the past 8 weeks, finishing his last dose today. He's asymptomatic. So what is the best management? All right, so some people wanted to do no further testing. In fact, the majority of people at 39%. Now, this is a patient that you really want to be sure to prove eradication. This guy had a really clinically significant bleeding ulcer with hypotension requiring a transfusion. And because our medications for H. pylori are not perfect, this is a person that you really want to make sure that you've eradicated. So the 31% of you who chose H. pylori breath test in 4 weeks would be the correct answer, and we'll talk about why. So here's the H. pylori test: stool antigen, breath test, serology, histology, and rapid urease test, or CLO test. The important thing to remember is it's only the stool antigen test and the urea breath test that determines active infections. Especially when you're looking for eradication testing, these are the most cost-effective, practical ones to do. But remember, you shouldn't do it any sooner than 4 to 6 weeks after you finish therapy. And so in the case that I presented to you, again, waiting 4 weeks, doing a breath test, you could have also done a stool antigen would be reasonable.